But I really urge you to watch the last one because this is chilling. This is a news report that includes several, I'm not sure whether they were doctors or lawyers, but they're talking about the Jahai McMath case that Dr. Byrne mentioned. And they are talking about how ghoulish, not the death industry is, but the parents, because they're carting this, quote, dead body all over the city and all over the country. And so they're calling the parents ghoulish. And this was in 2014, so this was quite a few months after she had been declared brain death in California. So she was very much alive at that point. And this is all about the brainwashing that Dr. Byrne was talking about. So I don't want to take any more of his time. When he's finished, we'll break for lunch. And at that time, I'll tell you what time we'll reconvene, okay?
You know, one of the problems is that I have so much to say, and if my kids were here, they would say, don't let him have a microphone, he won't ever shut up. But it isn't just that I have so much to say, but I really want you to learn it. I want you to know it. And and it's really easy. And if my wife were here, she would say, well, sure, it's easy for you because you study it all the time. Well, all of that is correct, but I study it all the time to put it into words that you can grasp and you can deal with. And see, it's not an opinion about whether Jahai is alive or dead. It's a fact that she is alive, and it's a fact that she's not dead. And it's the same way with Aiden and Maylene. These are not opinions. And I did another television recording that you can get to through Terry Schiavo, the foundation, and get a link to that. And if somebody, it could have been Bobby Schindler himself, that said, well, get a second opinion. You can get a second opinion, a third opinion, a fourth opinion. I don't care how many opinions you get. If they're wrong, it's wrong.
Right.
Right is right, and you don't need another opinion. If somebody, and part of why Aiden is alive still is because, yes, there were 2 doctors who said she was brain dead, and then the father said, no, not to get another one. You know what? They did it anyway, even though the father objected. So another opinion is just another one to fight, so opinions, and see, it's fact. It's not an opinion. You know what an opinion is? An opinion is a conclusion you come to when you have inadequate information to come to a factual conclusion. And life is a fact, and death is a fact, and they're different. Okay, so in brain death, the Uniform Determination of Death Act, and incidentally, I will do whatever it is to adhere to the time, and when I get done, I still have a whole bunch more. Whether I use them or not, I don't know, but we're going to do a couple of things. The Uniform Determination of Death Act, the law says, irreversible cessation of all functions of the entire brain, including the brainstem. It sounds very strong. I think it probably came out of the fact, well, okay, so single function's not enough, so tell us what you want. So I think they said, okay, we want irreversible cessation of all functions of the entire brain, including the brainstem. Sounds very strong. But then the determination is made in accord with accepted medical standards. And if you just take, how does this fit in? EEG is recording of brain waves, okay? And before you declare somebody brain dead, it would be usual to do a brainwave test. It would be customary to do a brainwave test. It would be ordinary to do a brainwave test. It would be reasonable to do a brainwave test. Yet it's accepted not to do a brainwave test. That's how the law is so very weak. On the other hand, while it's so very weak, what they have done in the Jahai's case and what they did in the Aiden's case is they said the only thing that's acceptable is the guidelines put out by the American Academy of Neurology. And so they did it in both cases, and which is completely different from the way that I thought the law was. I thought the law could have a lot of different things, but they focus it down to just this. That's the only standard. Well, how has it been argued in the Aiden case is that there are more standards, and then in the Aiden case, she had brainwave testing 3 times, and each time it showed some brainwave activity. She never had flat brainwaves, and so that's the argument at the Supreme Court. She's had 3 brainwave tests, she's never had flat brainwaves, so how can you say she has cessation of all functions of the entire brain? Okay, the way they say it, it's because the guidelines call for really only 3 things. One is unconscious in a coma. And somebody's in a coma is unconscious. And then absence of the cough reflex and the gag reflex. These are reflexes. And then the eye reflexes, the light in the eye, the touching of the cornea, that kind of thing, and then the ear eye, ice water in the ear, and when you put ice water in the ear, the eye turns towards the ice water. You put warm water in the ear, the eye turns the other direction. These are reflexes, and so there's about 5 brainstem reflexes that they check: coma, absence of brainstem reflexes, and then the apnea test. And the apnea test, that's a pull the plug test. They pull the plug. They take off the ventilator. They take off the ventilator. You see, a person on a ventilator gets a breath every 2 to 5 seconds. We take a breath every 2 to 5 seconds. 12, 15 times a minute or 20 times a minute, we take a breath. That's the way the ventilator works too. It pushes the air in that length of time. Well, they take the ventilator away for 10 minutes. They suffocate the patient for 10 minutes. It's like putting a pillow over their head for 10 minutes, and it makes the carbon dioxide go up. When carbon dioxide goes up, it makes the brain swell. It makes them worse. It's a lethal test. So you must learn no, no, no to the apnea test. No one should get an apnea test. Not ever. You never have to do an apnea test. It's not a test for sleep apnea. That's a different thing. Don't get them mixed up. This is apnea. Apnea means without air, without breath, is the root of apnea. Okay, then they don't wait for brain death anymore because they're getting this thing. It used to be donation by brain death. Now it's donation by cardiac death. And every hospital, it's part of why I don't have my job anymore, because I objected so much to doing this. So they find ways to get rid of you if you object too much. But donation by cardiac death, every hospital has to have a cardiac death policy. And what the cardiac death is, they want to get organs, or they want to stop a ventilator, but they have a functioning brain. So that they get a do not resuscitate order. That's the first thing. So do not resuscitate is a bad order. No one should ever have a do not resuscitate order. They get a do not resuscitate order, and then they take them off the ventilator, and then they wait until the heart stops pumping enough to cause a pulse. Not until the heart stops, but until they become pulseless, which means the heart doesn't pump strong enough to give a pulse. And when they're pulseless, depends on where they are, 5 minutes is the most, sometimes 2 minutes. In Denver, Colorado, it was 75 seconds. 75 seconds without a pulse, and that was the signal to cut the beating heart out of the baby and give it to another baby. And so pulses for a period of time, and then the organs are taken. Distinguish organs from tissues. Organs are heart, lungs, kidney, liver, pancreas, and the intestines. They all come from living persons. But they're declared brain dead or cardiac dead, but they're not truly dead. None of them are truly dead. You can get tissues from those without circulation, because the tissues, skin, bones, corneas, heart valves, veins, connective tissues, because they don't have the demand for oxygen, so they can go a longer time without oxygen before they're destroyed. The laws are all set up to get organs, and the Uniform Anatomical Gift Act was revised in 2006, and it's already passed in 47 states. There are only 3 states that don't have it. This state has it, and it presumes that everyone intends to be an organ donor. It's presumed that everyone has consented to every test to be done to you to see if your organs are good for someone else, and it's presumed you've consented to everything to be done to you until they can find someone to give your organs to. And you know what presumed consent is? It's no consent. But the law says you can do it. It's legal. And the laws are all set up to get your organs. I told you about the Discrimination of Death Act, and then you all have heard of the HIPAA law. The HIPAA law, that's the one they tell you about. That's the one they tell you about because you have to sign this paper when you go to the doctor or wherever you go. And you think it's to keep your records private. That's what you think. Let me tell you, as soon as you're in medical school, they drill it into your head that you don't talk about the patient in the elevator, you don't talk about the patient in the cafeteria. And if you think you drill it into doctors' heads, ask the nurses. Doctors and nurses never talked about patients. And so you didn't need a law, but why do you need a law? Go read the HIPAA law. There's 14 ways that the government can get your information without your permission. And they can use it without your permission. And they even built into the law that if a relative of yours finds out that they did that, you can appeal. But you appeal to the same people that said that they did it. And so it's never going to be successful. And all that's built into the law. Why do I know that? Because I read the law. And anybody can go read the law. It's a long law, but go read it. It's all there. I counted 14 ways. And then look at that law, the PPACA law. Do you know what that one is? You heard Doug talk about it. The Affordable Care Act. But the Affordable Care Act has PP in front of it. And that means the patient protection. It's called the Patient Protection Affordable Care Act. There's no protection for the patient in that Affordable Care Act, but that's how they do it. It's brainwashing. You gotta know. You're being brainwashed all the time. I hope I'm not doing it to you. Anyway, but I mean, that would really be awful if I did. Sometimes my kids would say, "Come on, Dad, just give me an answer." Well, that's because I was thinking my way through it before I gave them the answer. Eventually I learned I just had to give them an answer because that's what kids want, that kind of thing. But I was always trying to be careful not to brainwash them, but to teach them and give them a good example and that kind of thing. And all our kids are grown up, so I can talk about them. They're all above average, I just thought I'd tell you. And you should see our grandchildren. We have 12 children, I don't know if we told you that. But, and one time I was on the radio and then they asked me what I thought about Planned Parenthood. And I told them, well, I really don't know much about it except one time. At one time we had 5 boys and 1 girl. Now we got 5 boys and 3 girls. And of course there were a bunch of ladies in the audience. It was at a coffee at lunchtime kind of thing, and they roared. They thought it was really funny. But eventually we ended up with 6 boys and 6 daughters. And we have 33 grandchildren, and my wife and I always said that we'd rather have 1 more than 1 less. And then when we had 12, my wife said, and God knew what he was doing when he sent us only 12. One time, one of the kids said to my wife, they said, "Mom, if you had to do it all over again, would you have 12 children?" And without batting an eye, she said, "Well, yes, but I don't know if I'd have the same 12. These are all true stories. You ought to hear the ones I make up. Okay, that's the Uniform Determination of Death Act, and I showed you this loophole, and I might be able to make this work. Yes. I showed you this loophole with accepted medical standards. That makes it the weakest of all laws, but they have turned it around and make it that they, see, how many different laws are there? Between 68 and 78, there were 30 different laws passed, 30 different laws, or criteria, I should say, not laws, but 30 different sets of criteria. Each one becomes less strict, and there's many more since then. And so they're saying now of all these 30, maybe 100, I don't know how many different sets there are, but now they're saying the only one is the guidelines, and they are guidelines, and guidelines are not standards. They're guidelines. That's the only one that counts. So they've turned it around. We'll see if it backfires on them. See, what we stand for is the truth, and then what I do is I do what I can, as good as I can. I'm not trying to make myself sound like I'm saintly, because if you follow me around, you know I'm not. But I watch what God does. In Aiden's case, we did not have an attorney. Did not have an attorney. No attorney would take Aiden's case. And then I got a hold of Judy Brown, and she gave me the name of an attorney in Reno. And so we got an attorney to help. But that's how it happened. And then I argued in court. I say I argued. In court, I don't argue. Lawyers argue. All I do is answer their questions. But I did everything I could to show she was alive. And then the judge says, well, I can't pay attention to you because you're not a neurologist and you don't have a license in Nevada. So she threw out all my testimony. But the one testimony that did get in, we did get at the last minute through another pro-life source. We got a doctor who came forward, and the doctor said about the EEG. So it turns out that that's God's way, not my way of arguing. Just like Jihad, it was my way. I wasn't being successful. In God's way, somebody else came in and did it. And so I watched God, how he's doing. I don't know what this is all about, but I know this much, that Jihad is alive and Aiden's alive because of God and because they have someone who loves them. That's what it's all about. And that's what we're doing, and we're standing to protect and preserve life from true conception until true death. This is about the Anatomical Gift Act, and I was going to pass over this, but this word, sound mind, in the beginning you had to be of sound mind, but they took that out of the law. But that word sound comes from the Latin word sonus, sound, which means whole, which means alive, that kind of thing. Sanity, healthy, that kind of thing. So sound is a word that's there. Incidentally, I have a lot of dictionaries. I use 3 of them the most. One is the most up-to-date Webster's, and then I have an 1867 Webster's, which gives me the root of the words, and then I have an 1864 medical dictionary, which gives me the root of medical words. And so start with the dictionary. You've got to define the terms, and then and our language is a language for life. Now, opt-out cards. Incidentally, things that you can get on the back table is this thing that I've stapled together. It's this booklet, and on the front of this are the opt-out cards. And these are very important because you can sign this. The yellow card that's with it is just a direction how to do the white card. But everybody needs to carry the white card. And what it says is you want to be treated. It says, I direct all medical and surgical treatments and care, including food and water, but it calls it nutrition and hydration, be given to protect and preserve my life. It says you want to be treated. And then it says, do not hasten my death, do not shorten my life, do not do an apnea test, do not take any organ for transplantation or any other purpose. I think you should carry that, and I think we should campaign to get opt-out cards for everybody, and for our, especially for our children. And then in the booklet, the last page of the booklet is just like the opt-out card, but it lets you get it notarized. That gives a little more legal clout. Now, what else is in here? There's a power of attorney for yourself. And you need a power of attorney because you already heard Mary Ann give the example. If someone doesn't have a power of attorney, the law, at least in New York, the law is that the judge will appoint a power of attorney, and it probably won't be your mother or your father, that kind of thing. So they'll appoint somebody. Who will it be? It'll be another lawyer. And what kind of judges do lawyers appoint? The kind that think like them. So you don't have a chance once you get in the system. So power of attorney for yourself, and then power of attorney for a dependent person. And then what do you do when that dependent person becomes an adult? They have to have a power of attorney for themselves. So we must start to campaign for our children who get to be 18 and become adult age, that they execute a power of attorney and put the parents. And so we have to do that. So when I heard about that, I was thinking, how do we solve that? Well, the way we solve it is we treat them like adults. So they have to do just like we do. Okay, then there's also living person on earth. That's a very important one. And there's other things in this book. Now, also on the table back there, I gave a copy of my slides, and so you can pick up a copy of my slides, at least most of them. And then there's a yellow booklet. American Life League prints this. I think it was 9 other doctors and myself wrote this a number of years ago. It's still very good. This is the teachings of the Catholic Church. It's written for everybody and anybody. The only time you can find out that it's Catholic, though, is we have a reference to Pope Pius XII, and quotation of Pius XII. But it's for everybody. We wrote it for everybody, not just for Catholics. It's good for Catholics and for everybody. Then inalienable rights, I told you about that. And then just a few weeks ago in the readings at Mass, Romans 1:25, they exchanged the truth of God for a lie and revered and worshiped the creature rather than the Creator, who is blessed forever. You see, and that's what we have going on. They exclude God from all of this, and then man, just the creature, is the one that's making the rules and the laws. And that's not what we're all about. And we must take a stand for life, which is a stand for God, a stand for life, and from true conception until true death, and no exceptions. And it does no good to be a right to life movement that takes a stand against abortion and lets contraception go on. It does no good. It does no good to take a stand against physician-assisted suicide and allow them to cut the beating heart out of an 18-year-old. It does no good. I'm not opposed to taking a stand against abortion. I support those people, but sometimes I get right in the face of the people that are very good people taking a stand against abortion, but they won't say anything against anything else. And I'm happy they're against abortion, but I think that we must be more than that. And I don't know. I don't know what's going to happen next. I don't mean just next in 5 minutes or today. I don't know what's going to happen next. I just know that this is what we're doing today, and we must pray, and we've done that. We started with prayer. We must keep praying as we go along. Father gave us some good suggestions in terms of praying in the morning and praying in the evening and then praying in between. If you do in the morning and the evening, you got a chance. You know, my wife and I were married for 48 years. Now, how did she stand me that morning? Well, we prayed, and sometimes she would say, "Thank God for bedtime." And what she meant was tomorrow was another day, if you know what I mean. And it's that kind of thing. And then because sometimes things get to be not easy, not only just husbands and wives, but with children. And thank God this day ends, and then we got a chance tomorrow to start again, and that kind of thing. And I have to get up to this. I told you about this, so I don't have to do that. There's the baby that they cut the beating heart out, the 3-day-old baby. You see he's a whole baby. He's being ventilated. This kind of equipment, by the way, this is heavy metal equipment. This is the way we breathe for babies in the beginning. We would have that, a constant flow. We put our thumb over it and push the air in, and we watch till the chest expanded, and then we take our thumb off. The first piece of equipment, when I was in St. Louis, which is a big community, I had the only resuscitation bag for babies, resuscitation. I carried it in my car, and I carried from hospital to hospital. I still have it at home. Every now and then I get it out to kind of look at it, laugh at it, kind of thing. But that baby was very much alive, and look what they did to him. They packed him in ice. You want to know what that's all about? Go put your arm in ice and see how it feels. But they packed him in ice. Actually, he was born in Oregon, and they transported him to Brooklyn to take his organs. They were advertising to get somebody when Christian Bernard aged them out by doing the heart transplant in South Africa. They wanted to do it in the United States. But that's how they did it. Packed him in ice and cooled it, it reduces the metabolism, and then kept things going until they got him to Brooklyn to transplant his heart. This is a drawing of the brain, and the largest part of the brain here is the cortex. You can see that the brain fills the skull. There's not much room in there. That's a cortex. And then when you do brainwave testing, the brainwaves are only recorded from this outer 1 centimeter of the brain. It doesn't record anything down here in the rest of the brain, only the outer 1 centimeter. And remember, they don't have to do that. But if you do record brainwaves, it just comes from the outer part, tells you nothing about what else is there. Then the other thing, you see the largest part's a cortex. The next largest part is the cerebellum. Remember what brain death is. Remember I told you the 3 things. One is unconscious and in a coma. And when somebody's unconscious, it's impossible to evaluate the cortex. It's impossible to evaluate the cerebellum. So those are just excluded. How do you evaluate the cortex? I might say, what's 6 times 4? And immediately give me the answer, 92. But that would be a way. That would be the cortex. How about the cerebellum? We go to the doctor, and the doctor says, touch my finger, touch your nose, touch my finger, touch your nose. That's the cerebellum. Or stand with your eyes closed. When somebody's unconscious and laying on the bed, you can't say stand with your eyes closed. They don't evaluate the cerebellum. And then look how they put it over on Pope John Paul II, the advisors. They use in language, Pope John Paul II used cerebrum, cerebellum, and brainstem. No set of criteria uses the cerebellum. Not one, anywhere. And yet they got him to say that. Yet, the Pope John Paul II said lots of good things, and he said the right things, and so did Pope Benedict, saying you cannot take organs that occur singly in the body except from a cadaver, which means you can't take them. The heart or the whole liver is a single organ. And so the teaching is very clear. But then they got onto the neurological criteria, and they got him to say cerebrum, cerebellum, and brainstem. The Pope is a holy man. He's not a doctor. And us doctors can do lots of things to fool you. And they put one over on him. One of his advisors was the same man who helped save his life when he was shot. So obviously he's going to pay attention to him. I don't know if he did that, but in any event, okay, now get back here to the brain now. Here's the brain stem. It's down here at the bottom, and the reflexes are all reflexes of the brain stem. And then there are 14 brainstem reflexes, but they evaluate 5, at the most 6. Remember I told you cough, gag, light reflex cornea, ice water in the ear, 5 or 6 they do. They don't do the others. Why don't they do the others? They're more difficult to do, they take a longer time, and you might find a response. They don't want to find a response. They don't want to find a response. Why not? Because they want your organs. Anyway, then I'll tell you some more about this. You see, it's very tight in here. There's not much room. And then look what's down here. You see this? That's the pituitary gland. It's outside the skull, and then that's attached here by this stalk to the hypothalamus, which is in here, the hypophysis. And so what happens is that when somebody has an injury to their brain swells, and so they reduce the amount of function, they reduce the function of the hypothalamus, which reduces the function of the pituitary gland, which reduces the function of the adrenal gland and of the thyroid gland. And so the people have some function, and Aden and Jahai have some function of their hypothalamus, so they make thyroid stimulating hormone, but not enough. So they get deficient in thyroid. And why is Jahai alive? Because she got thyroid. Why is Maylene alive? Because they got thyroid. And it's very important. And I've been working with Dr. Coimbra from Brazil for more than 20 years, and has come up with these things about how to treat patients that have these severe things, and hypothyroidism is what they have. Aden has documented hypothyroid, but they won't give her thyroid hormone. They refuse. They won't give it to her. It's inexpensive, it's easy to give, and it can't hurt her, but they won't give it to her. Why not? Because they say she's a dead body. And the other reason is she might respond. I can tell you, I have thoughts about giving it to her anyway, but we're just too concerned about doing that, at least in Hayden's case. But in any event, remember the brain swells. Okay, so what happens with hypothyroidism is that when somebody is hypothyroid, they have swelling. So what happens is they have the injury of the brain that has swelling, and then it's compounded by the hypothyroidism. And so if you give them thyroid hormone, it reduces that swelling, and thyroid hormone is necessary for all of us just to live and certainly to heal, and it's necessary to heal the respiratory center and of the brain. And so what is happening? What's happening is that somebody is unconscious, and then they do the apnea test, which makes their brain swelling get worse, and that makes them even have less thyroid hormone, and they compound the problem. And medicine is so different. You see, the way that I learned medicine is the challenge was to make the correct diagnosis. And then you hoped and prayed that there was a treatment. And every time you got a new treatment, you thank God for that. What's modern medicine all about? What modern medicine is if you have something that it looks like we don't know how to diagnose you, you ought to get out of my life, go someplace else. Or we don't have a treatment for you, you ought to go to hospice or palliative care. That kind of thing. It's a different kind of medicine. That you see now. I'm excited about new medicines, the CAT scans and MRIs, and we have replacement for knees and hips, and there's lots of exciting things about medicine, but there's lots of things that go on. Like medicine went in the wrong direction when they invented brain death, because they said it was okay to pretend like somebody was dead because their life was of less value than somebody else's life. And even if it was a little bit evil to shorten their life, they get some good out of it. That's where that proportionalism and consequentialism gets in there. And you have to understand all of that to understand it. It isn't that the doctors that are involved with transplantation are evil people. Most of them, I don't even think they know. They cut in there, they see the beating heart, they say, so what, kind of thing, or whatever they say. So it isn't that, but it's a kind of thing that there is truth. And there is truth, and you're either alive or you're dead, and that kind of thing. But when they went in the direction of changing this thing about death and invented brain death, that made a major change in society. And that occurred before Roe v. Wade. That occurred in 1968. Roe v. Wade didn't happen until 1973, when they legalized killing the unborn baby that they can't even see, but they had already legalized, and Kansas already had a state, had a law to accept brain death. They already had laws, it was already legal, it was already being done to cut the organs out of 18-year-olds and 20-year-olds. It was already legal and accepted. That was the wrong direction. And I don't know how far we would have been if we'd have gone in the right direction, but just because we did the wrong thing then doesn't mean that we can't straighten it out. Incidentally, brain death is false death. It's not true death. And it wasn't simply a mistake. I'm making it like it's a mistake that you can straighten it out. The difference between a mistake and false is that a mistake is like when you aim at a target to hit the bullseye, but you miss, so you're off a little bit. You might not even hit the target, but you can readjust your aim and get back on. Something that's false, it goes in the other direction. You can never straighten it out. Brain death is false. There's no way. There's no way. You can think about it all you want, trying to figure out how to make a better set of criteria. In the beginning, just so you know, when I got into this thing and realized that there was something wrong with it, I tried to find a laboratory test that would be, that you could do the test and prove that there was brain death. I studied 250 babies. I studied 250 babies looking for creatine phosphokinase, the brain-based fraction, and the most I could do is predict that they were sick and they stayed in the hospital longer. But I didn't do it to make them brain dead. I did it to find out if there was a laboratory test for destruction of the brain. And there is, but you can't use it to make the diagnosis of brain death, so it got thrown out. I wasn't the only one doing it, but I was trying to make it right. You can't make it right because it's false. I told you about this already. The Harvard criteria, it's not based on science. They did no animal or patient studies. There's no consensus in the criteria that's written in Neurology 2008. It's not evidence-based. And evidence-based is that's based on some kind of scientific studies or something. They admit it's not evidence-based. And so April 2015 in the literature, there's language that says there's substantial differences worldwide. And then Pope John Paul II said, well, use the words clearly determined parameters commonly held by the international scientific community, but they do not exist. That kind of thing. They give no information to the patients or the relatives when they do the apnea test, but they can't. How could they come to you and say they're going to turn the ventilator off on your wife for 10 minutes, and how could they get you to say yes? You wouldn't say yes. You'd say that's wrong. And you don't need to know much about it. You just know that that's wrong. And so they can't ask the relatives. So they give them no information. And then there's this thing, and I got onto this thing. I said, well, we got a campaign to get informed consent. You can't get consent to kill somebody. You can give them all the information you want. Informed consent is a legal term. More consent won't work. You can't give consent to kill somebody. So it won't work. You have to come at this from God and from life. And then pastoral care people. I wrote an article in Renew America on what's happening to pastoral care people. I wrote that. Do you know how many responses I got? None. No response. I wrote it trying to get, you can go look at it, Renew America, and read it. It's a year or so ago, but you can look at it. Who decides? Relatives, hospital administrators, coroners. Apnea test, I already told you about that. I told you about that. Now, the only reason I'm doing this is because some things, and I think she said 12:30, didn't she?
Yeah, you're fine. You're fine. You're fine.
I'm okay.
You're okay.
Use of narcotics for patients. Pius XII said, listen to relieve pain by narcotics, even when the result is decreased consciousness and a shortening of life. And then he said, and I put the emphasis in there, if no other means exist, and if this does not prevent the carrying out of other religious and moral duties, it is not right he said, it is not right to deprive the dying person of consciousness without a serious reason. So and the teachings are good, and we live in a world where everybody focuses on pain. Nobody wants to have pain. Well, I don't want to have pain either. But on the other hand, sometimes it's better to have a little bit of discomfort. I hear a lot of people saying they go to the dentist and they want to get put asleep. Well, they put their life in jeopardy when they get put asleep, especially where you don't have somebody to resuscitate you, like in a dentist's office, when you get a local anesthetic, and you won't have pain that way either, although it's not without difficulties too. And then physician-assisted suicide, Evangelium Vitae. If you haven't read it, you should read it. There are 3 encyclicals that you should read and learn frontwards and backwards. One is Evangelium Vitae, the other one is Veritatis Splendor, and the other one is Humanae Vitae. You should read them, learn them backwards and forwards. To concur with the intention of another person to commit suicide and to help in carrying it out through so-called assisted suicide means to cooperate in, and at times to be the actual perpetrator of an injustice which can never be excused, even if it is requested. And so the teachings of the church are clear about that. And of course, we know it's already legal in the Netherlands, Oregon, Washington, Vermont, California, New Mexico, and Montana, but there's no statute in Montana. St. Augustine, it's never legal to kill another, even if you should wish it. Indeed, if he requested, because hanging between life and death, he begs for help in freeing the soul struggling against the bonds of the body and longing to be released. Nor is it licit even when a sick person is no longer able to live. True compassion. Compassion means to suffer with kind of thing. I'm sharing that. Okay, now, I'm not going to show these, Marianne. I know I was getting Marianne worried. She's not even in here. I know she was going to get worried if she saw me start on another set of slides. But I don't really use these, but it has to do with ordinary and extraordinary means. So often when I give talks, that's what people want to learn about. And they ask questions. Well, what do I do under these circumstances? What to do with that? So if there's time and the opportunity, then I would say something about that. But other than that, we will stop for lunch and then continue on.
You still got 7 minutes.
Yeah, please tell us.
Well,
By the clock.
you think I should try and do this?
Yes.
Okay, I'll try.
Now you're in trouble.
Medical ethics has to do with ethics is how one ought to behave. Incidentally, bioethics, you can't put them together. They're like oil and water. Bios has to do with the study of life, and everything in biology is all set in place. You can learn about it, kind of thing. Ethics has to do with how one ought to behave. When you put them together, they don't mix. And so you can't do anything about biology. Ethics is how one ought to behave. And ought comes from the root of ought is to owe. And so what we do is we owe something to the person who can't protect and preserve their own life. The means ought to protect and preserve life by preserving the unity of the soul and the body. Then the rights of liberty, I already told you about that, liberum arbitrium. The Hippocratic Oath, you know about that. Aid, heal, do not kill, do not harm. Good ought to be done, evil must be avoided. And then moral acts. Ordinary and extraordinary means has to do with the means. And the means are an agent, an instrument, facilities, or a person, or thing to which an end is affected. So it's the means to the end, and then something is conveyed, transmitted, communicated, or the like, and the reference is to the patient's needs, not to the judgment by the caregiver. So it has to do with the means, and then ordinary and extraordinary means are related to the life of the person. And then the reasoning person must consider them side by side. So you can't have these are ordinary means and these are extraordinary. You have to consider them side by side. And then must consider that they represent decisions to consent to treatment and care for him or herself. You have to try, my wife and I work together, and she, her only way out was to go to heaven almost 10 years ago now. Some people say I shouldn't say she went to heaven. Well, I bet she did, living with me. But that was her only way out. But as much as we relied on each other and helped each other, we still knew that it was her life and it's my life, and we could do things to help protect and preserve. But even if you're married 48 years, there's still things that you can't exchange. So it's for themselves. Okay, the means used must have their final results to aid, heal, not to kill, and not to harm, which is to protect and preserve life, keep the body and soul united. So whether they're ordinary or extraordinary means, that's what they're for. A person must not kill or do harm to himself or others. A person must try to live the entire lifespan given by God. The physician evaluates, he intends ordinary means to protect and preserve life, and there's an obligation for that. He intends extraordinary means to protect and preserve life. Then some say they're optional. Well, it isn't optional exactly, but the reason you use extraordinary means is why? Because you are an extraordinary thing. You're an extraordinary person, not a thing, but a person. And if an extraordinary person gets an extraordinary illness, then we ought to try to give them the extraordinary treatment. Now, it could be that some treatments are ineffective. Well, they don't even come into this. Things could be experimental. No one says you have to undergo experiments, but that kind of thing. So there's things that get thrown out. But it isn't just because, and they used to say things like a ventilator was extraordinary. I don't think it is at all. But on the other hand, it could be not required kind of thing. So you have to have all of the current information before you can make a decision. My wife had a ventilator multiple times during the time that she was going through illness, and my kids, if you talk to them, my one son, Tom, is a doctor, and my daughter's a nurse, and some of our other kids said, yeah, 3 times between you and Tom and Ann, you saved Mom's life. But she was on a ventilator multiple times. But when she died, she didn't die on a ventilator, and she didn't have a feeding tube, but she could always eat. And she was here. She'd say she was good at it. But on the day she died, she received communion, and the day before too. And so everybody doesn't need a feeding tube before they die, and everybody doesn't need a ventilator before they die. But it isn't just because it's an extraordinary means. These things have indications, they have contraindications, and we have ways of doing them, and doctors don't know all the answers, but what we must do is stay in touch with God, and then realize what we're doing is to protect and preserve their life. Ordinary means protect life from its origin and preserve life to its finality. Extraordinary means protect and preserve life. If no other sufficient remedies, petition with the patient's consent to have recourse to means provided by the most advanced medical techniques, even if experimental. You can do experimental, but you don't have the same obligation. It's also permitted to interrupt them when results fall short of expectations, but never done to cause harm or death. And these are principles are there. So far as a ventilator is concerned, Patients die on a ventilator. You don't have to stop the ventilator to make them die. Patients die without morphine. Over the years, I've taken care of many patients who've died. That might not be... But when I started in neonatology, every baby less than 3 pounds and 4 ounces that had trouble with breathing died. Everyone died. That's why I started to do it, because the babies died. I've never given morphine to a person who's died. My wife got something for pain in the last 2 months that she lived 3 times. But she didn't get anything at the time near her death. You know, people died. They died peacefully. People die peacefully, except when? When don't they die peacefully? They don't die peacefully when you dehydrate them. You know, one of my friends asked me if I would go to hospice to see a friend of his, so I did. And so across the room was a man who had a stroke like 12 days before, and there he was, sunken cheeks, small breathing. It's a terrible way to die. And what happens when the body gets dehydrated, then the kidneys can't compensate and they get acidosis. And then when we get acidosis, the respiratory system tries to compensate for the acidosis, and then they breathe in and out, in and out. We call it small breathing. And it's a terrible way to die. And so how do you control that? You don't need morphine, you need an IV. It's very simple. And that kind of thing. Now I'm almost there. Water, the need is only secondary to oxygen. How much water do you need? A continual supply, about 2,500 cc's. It's about 7 glasses of water. The intake is regulated by thirst, but not in infants or in extremely ill persons. It's essential. Water is essential for thermal regulation and for life on Earth to continue. Water and food, like Aiden needs a feeding tube. She needs a feeding tube. They won't give her a feeding tube. They won't give her a feeding tube. They've been giving her some nutrition, protein, and fat in her vein, but it makes her liver fail. And her liver's failing, and we've sent multiple letters to the administrators and the doctors. They won't give her a feeding tube. They won't give her thyroid medicine. She's been there for 7 months. She's needed these things, and they won't give them. They're ordinary means. They're not extraordinary. Signs of water depletion, dry mouth, no decreased urinary output, coma, and then they die. Withholding food and water leads only to death. Stomach lining, small breathing, I told you that. Denying water and food to the patient, for example, the persistent vegetative state, that's wrong. It's against the science of medicine. It's against the oath of the caretaker. It's forbidden by the Bible. Ecclesiasticus 29:21 and 39:26, and Matthew 7:9-11 warns of punishment for those who refuse aid to the needy. Giving food and water, which Pope John Paul II taught very clearly about. I wish he would have taught about more things than that, but he did food and water. Extraordinary means considers the person is made to the image and likeness of God. The love of the neighbor is the way of doing good. The closest neighbor is our family and even an enemy. Ineffective treatments are contraindicated. The objective of stopping a treatment or not using it must never be to cause death. When the means touch on a person's liberty, means must not be denied. Current decisions, I told you about that. Treatment and care, protect, preserve, and modern times doctors and nurses must defend life. Do not avoid non-specific orders like do not resuscitate. Do not resuscitate, and you can read in this book to get some idea about how to do with that. That's not a good order. Do not resuscitate, who knows what it means. No code is not a good order. Incidentally, on the handout that I gave you that has one of my slides, on the back page is a medical directive. On the back page is a medical directive that you can fill in the names and that, and it will help the person who's unconscious and needs help. You have to get that for them right away when they're in the hospital. With that, we're going to stop for lunch. You see, I could have stopped 10 minutes ago, but you said you gave me 5 more minutes. And Thank you.
We are so blessed to have Dr. Bird. I mean, God knows what he's doing, letting him have a long life and all those wonderful children and grandchildren and great-grandchildren. You didn't tell us how many great-grandchildren you have.
We have 5 great-grandchildren.
Okay, so that's wonderful. I'm excited.